I was diagnosed with lupus in 2019, so I went to a ton of different doctors. I was in and out of the hospital. Finally, after labs and a kidney biopsy, I was diagnosed with lupus nephritis and SLE.
Hello. Selena was referred to me by her nephrologist. She had a good response to treatment for her kidney inflammation, but despite that ongoing treatment, developed other lupus symptoms that were not responding to that current therapy.
It was impacting my quality of life because I was in such extreme discomfort. I had no idea what was going on, and I was also a teacher in New York City, so I was having to go up and down stairs all the time, and at that point it was so uncomfortable with the swelling that I was experiencing in my body.
Selena was really in a lot of discomfort when we first met, so she was actively looking for some alternative to treatment. And fortunately, this particular alternative meant that we could add it to what she was already taking.
When I first met Dr. Sammaritano over Zoom, she really gave me this strong sense of comfort. There was no rush. She wanted to get to know me as her patient. It was my first visit with her, and she asked me about all of my history, which was really important to me seeing a new doctor. She wanted to know every single detail about everything I've experienced since I was diagnosed.
We talked a lot about potential, risks or side effects. Overall, this is a well-tolerated medication, and she did tolerate it well.
She really wanted to make sure that I understood my disease and to figure out what we're going to do to make sure that I can live a sustainable life alongside it.
Patient education in lupus is critical. It really is. Lupus is a confusing disease. It's a multi-system disease. It can affect almost any part of the body. It can be very challenging for patients and for their doctors sometimes to sort out what is due to lupus, what might be due to side effects from medications, or what might be an unrelated symptom. The more patients know about potential symptoms, what to expect, therapies that are available, and side effects of those therapies, the better prepared they are to communicate with their doctor about any issues or questions that they might have.
So I started sharing my lupus journey on social media, and there was this whole online lupus community that I didn't know existed, and they welcomed me with open arms. And then it turned into so many other people that were living with lupus or newly diagnosed reaching out to me for support and questions. So that turned into me becoming a coach for women that are living with lupus. Right now I am working with about 30 women currently that I help empower them take control of their journey with lupus and reclaim their lives.
It feels incredible to have been a part of Selena's journey. I think that beyond the medical therapy, she has taken on other therapy that is incredibly important to our patients. Knowing what you can do as a patient to improve that type of symptom is really important, and I think that is a large focus of what she plans to do.